Like so many things in medicine, the answer is 85% of cases of hereditary hemochromatosis are due to inherited mutations in the HFE gene. Now, you can be a carrier of one of these gene mutations, and the vast majority of carriers will not manifest iron overload. If you are homozygous or have both copies mutated, the C282Y mutation in the HFA gene, or if you're a compound heterozygote, so you have one copy C282Y, one copy H63D, you're at risk for iron overload. People who menstruate or who can become pregnant will typically have a delayed onset of iron overload. So the average age of onset of iron overload, meaning accumulation of excess iron in the organs, in women or people who menstruate and that have the HFE gene mutation is in the 50s or 60s, usually postmenopausal. Now, in cases of much less common juvenile hemochromatosis, which is going to occur due to mutations in the hemojuvelin gene or HJV or in the HAMP gene, this leads to a much more aggressive form of iron overload that occurs much earlier and is not affected as much by the presence or absence of menstruation. So the most important thing to do in all hemochromatosis patients is to have regular monitoring and to intervene to lower the iron levels when they start to become high. If this is done, then organ damage can almost always be prevented. And the medical strategies for this are phlebotomy and iron chelation therapy. But what individual patients can do is avoid taking vitamin C supplements because this is going to promote increased iron absorption in the gut, and do things to protect the organs that are most often affected first by iron overload, which first is the liver and second is the heart. After that, a variety of endocrine organs and other manifestations of iron overload can occur. But in general, the first organ that hemochromatosis patients should be vigilant to protect is the liver. So by avoiding things that are toxic to liver, in particular alcohol. So if iron levels are still in normal range, the good news is that the risk of developing iron overload is really low. And in the case of HFE gene mutation related hemochromatosis, this is a slow process. So as long as you're having regular monitoring, intervention can be undertaken before iron overload ever starts to develop. In juvenile hemochromatosis, that requires very close monitoring and sometimes earlier intervention due to its more aggressive nature. Hope that helps. Follow for more information about blood.